Okay. Uh, Thank you, Professor. Good morning, everyone. Mr. Chairman, thank you, ladies and gentlemen. First of all, thank for the committee for giving me the opportunity to stand in this good forum. And also special thank to all audience for the patience and attention in hearing me to share my point of view and little bit experience in research of genistein and endometriosis. I came from Indonesia, I think far away from here. This is Brawijaya University, and this one's Faculty of Medicine, the place where I work every day. Brawijaya University is one of the prominent university in Indonesia, currently having more than 60,000 active students from various program and various faculty. And this is the hospital where I work almost 15 years as gynecologist, belonging to government with about 1,000 bed capacity. My topic today is about genistein and endometriosis. Endometriosis is one of the most frequent benign gynecological disease that was characterized by the implant and growth of viable endometrial tissue, matrix, and glandular cell outside the uterine cavity. Endometriosis is one of the most common gynecological disorders. It affects 10 to 15% of all women in the reproductive years. The incidence is about 40 to 60% of women with dysmenorrhea and 20 to 30% in those with subfertility and infertility. Endometriosis also affected humoral immune response, increased macrophage and age activity with induced general inflammatory response. This picture shows typical characteristic of peritoneal endometriosis, where we can see the endometriosis implant and also vascular pattern that more prominent than normal. Endometrial tissue implanted in the peritoneum is various in appearance: blue, black lesion, white plaque, and clear vesicle, accompanied by new formed blood vessel that we call it neovascularization. Endometriosis have many problems. The problem is very complex and a good solution until now. The pathophysiology is difficult to understand, involve genetic, environment, toxin, inflammation, etc. The symptoms vary from asymptomatic disease, infertility, menstrual irregularity, until severe pain in menstrual cycle and intercourse. Also, some patients accompanied by tumors. The diagnosis need endoscopy surgery and histological examination. It means very costly. And the therapeutic aspect is difficult. The modalities vary from hormonal therapy, surgical therapy, or combine of them. The goal is relieve pain, reduce endometrial nodule, remove the tumor, improve fertility, and increase the quality of life. Failure rate and recurrence rate is very high, and it stimulates hopeless for the patient and also tired from the doctor. In the molecular level, the root problem are angiogenesis, abnormal apoptosis pathway, chronic inflammation, independent estradiol synthesis by the endometric tissue, fibrosis that lead adhesion a long term that will make fertility worsen. And also, there is neuronal infiltration in the endometriosis and lead to pain. The major proinflammatory cytokines is the crossroad of the molecular pathway that involve the fundamental aspect in the pathophysiology of endometriosis. Cytokines such as TNF-alpha, interleukin-1B, released by peritoneal macrophage and ectopic endometrial tissue, activate transcription factor such as nuclear factor kappa B and activator protein 1. An active transcription factor bind to DNA of ectopic endometrial tissue will induce transcriptional activity of genes that encode for the following products such as interleukin 6, 8, macrophage immigration inhibitor, monocyte chemoattractant protein, granulocyte macrophage clone stimulating factors, and TNF-alpha in interleukin-1 beta. Also stimulate nitric oxide production, vascular endometrial growth factors, the most prominent progenetic factor endometriosis. Also stimulate family of matrix metalloproteinases, induce imbalance of apoptosis, also stimulate activity of many additional molecules. This is about genistein. Genistein is a natural molecule belonging to the isoflavones. Isoflavone is one of the class of phytoestrogen. Phytoestrogen means a compound looks like estrogen hormone, but originally come from plant. While isoflavones are widely distributed in plant kingdom, the concentration of this compound is relatively high in legumes, particularly in soybean. Genistein is clearly associated with prevention of degenerative disease, where its molecular level possibly through modulating certain signaling pathway. Genistein could inhibit tyrosine kinase, topoisomerase 2, and enzyme that involved in phosphatidylinositol turnover, induce apoptosis and differentiation of cell cancer, inhibit cell proliferation, modulate cell cycle, having antioxidant, and inhibit angiogenesis. Can be seen in this picture that phytoestrogen is non-steroidal compound that can be found in plant, especially legume and soy. Having molecular structure similar with endogenous estradiol, and the pathway of molecular action is through alpha estrogen receptor and beta estrogen receptor. Isoflavones, one class of phytoestrogen, and genistein is the strongest type of phytoestrogen in class of isoflavones. Genistein bound to beta estrogen receptors much stronger than alpha estrogen receptor. Can be seen also that the basic molecular structure of the genistein is similar with endogenous estradiol. This potential source of genistein mainly the soybean and their products such as tempeh, tofu, soy, milk, etc. And soybean products are identified as staple food for Asia population. That's why concentration in blood genistein in Asia people higher than another population. Another concept that should be understood in this context are selective estrogen receptor modulator or SERM. SERM is not an estrogen, progestin or hormone, but SERM also bind to estrogen receptor and has estrogen-like effect in some tissue, but having anti-estrogen effect in another tissue. A molecular structure of SERM different with estradiol, have capabilities to bound with estrogen receptor and modulate coactivator protein or co-repressor protein dependent on the type of SERM, tissue, dosage, and duration of exposure. From this definition, genistein could be classified as natural selective estrogen receptor modulator or natural SERM. There are two types of estrogen receptor, alpha and beta. Mechanism of action and interaction of these two types of receptor is very unique. Genistein binds stronger to beta estrogen receptor than alpha receptor. That's why molecular action of genistein through beta estrogen receptor. This is the summary of genistein pathway in the molecular level. As summary, research show that the molecular mechanism of action of genistein is very complex. In relation with cancer, genistein inhibits cell proliferation, induce apoptosis, anti-angiogenesis, inhibit tyrosine kinase and topoisomerase 2, and in endometriosis, similar with cancer, progressive, metastatic, chronic, recurrent, and difficult to manage. A few research in endometriosis show similar mechanism within cancer. Something that should be answered. What and how the genistein work in endometriosis. The objective of my research is to determine the role of genistein in endometriosis. Also to determine the effect of various doses of genistein to the expression of beta estrogen receptor, interleukin 1 beta, interleukin 6, 8, TNF alpha, nuclear factor kappa B, and the most important is to search alternative therapy with more benefit with lower risk. This is through experimental post-test only control group design. We use 33 female mice, 3 months in ages, and body weight about 20 to 30 grams. This is research operational. Mice model of endometriosis was made by implanted myometrium and endometrium tissue from adenomyosis disease in immunodeficient mice. Immunodeficient mice was obtained by cyclosporin A injection, then implanted was performed by injection into the peritoneal cavity. The ethinyl estradiol injection was performed intramuscularly on day 1 and 5. Mice were observed for 2 weeks or 14 days and then to be mice model of endometriosis. In this study, we used to group control negative and control positive. Control negative mean without intervention, the normal mice, and control positive mean mice with endometriosis without any therapy, without any genistein. And we give genistein start from 50 milligram to 500 milligram per kilogram per kilogram, 500 milligram per kilogram body weight, and we just observe for 2 weeks, and then we just understand and evaluate the result. We use genistein to make sure that no other substances involved and determine the effect. So we don't use extract from plant, but we use pure genistein. After the mice had been sacrificed, the abdominal cavity be opened and endometriosis tissue be evaluated. We can see that endometriosis tissue clearly observed in the peritoneal area, also more and more neovascularization. Red arrow is endometriosis implant, and if we compare with the control negative, the peritoneum looks very clean and clearly, and no endometriosis. This picture shows that there was marked neovascularization and growing of endometriosis implant in mice model endometriosis. The tissue had been processed to evaluate and variable research. This picture is a result of immunohistochemistry staining or the beta estrogen receptor. Brown color indicate expression of beta estrogen receptor in nuclear cell. More than the color means more high in expression. We can see that the highest expression is in the positive control group. It means in the endometriosis group without genistein. But in opposite side, negative control or normal mice show very minimal, also similar in genistein group. This picture is result of immunohistochemistry of nuclear factor kappa B, where immunohistochemistry staining of nuclear factor kappa B show similar pattern with beta estrogen receptor. As a whole, from stable, The lowest expression of beta estrogen receptor and nuclear factor kappa B was in negative control group, and the highest expression was in positive control group. And the genistein group stay, whatever the doses, stay in between. This diagram show the position of genistein group between negative control group and positive control group. Important thing that should be noted are the estrogen receptor play an important role in mediating estrogen action in atopic or ectopic endometrium development. In this study, genistein significantly decreased the beta estrogen receptor expression compared to endometriosis mice group to reach the level of normal mice. Some pattern can be found with nuclear factor kappa B. Another research show because of similarities in molecular structure between genistein and estradiol, genistein binding in same receptor with the endogenous estradiol. Binding affinity of genistein to ER alpha is 4%, to ERB is 87% compared with the endogenous estradiol. Genistein had stronger binding affinity to ERB than ER alpha. Genistein acts as anti-estrogen by binding to beta estrogen receptor and block the activity of coactivator protein, stimulate co-repressor protein, and the result is suppress of the transcriptional activity. Genistein anti-inflammatory agent regulate the expression of enos and COX-2, inhibit inflammatory cytokine and transcription of nuclear factor kappa B, also STAT3. And genistein suppress the role of nuclear factor kappa B as transcription factors in TNF-alpha signal transduction pathway, reduce the activation of EL1, EL6, and EL8, and decrease the inflammatory response in endometriosis. Genistein also suppress the activation of NF-kappa B and expression of inflammatory cytokine inhibit the growth of endometriosis cell. As a whole, we can see from this table that the lowest expression of tumor necrosing factor alpha, interleukin 1 beta, interleukin 6, interleukin 8 was lowest in negative control group and highest in positive control group, and genistein group, whatever the doses, stay in between. This bar diagram shows the position of tumor necrosing factor alpha, interleukin 1 beta, interleukin 6, 8, and genistein group between negative group and positive control group. Although looks there is a difference in concentration, but statistically no significant difference among normal mice, genistein group in olysis, except with positive control group. In endometriosis, high expression of beta estrogen receptors were accompanied by elevated level of EL1 beta, TNF-alpha, IL-6, and IL-8, and nuclear factor kappa B activation. This finding indicate that in mice model endometriosis, upregulation of the nuclear factor kappa B signaling pathway will stimulate pro-inflammatory cytokine production. As comparison, in other studies show that genistein in specific doses could reduce the expression of TNF-alpha and IL-6 in primary endometriosis cell culture. Genistein significantly reduced the expression of TNF-alpha, EL1, EL6 that had been induced by estrogen hormone, and study in saline had been induced by inflammatory agent and had been exposed with genistein in various doses for 12, 24, and 48 could reduce TNF-alpha and IL-6. Pure estrogen receptor antagonists will inhibit the activity of TNF-alpha, and genistein act as estrogen receptor antagonist. Another study in prostate cancer, 5 micrometer genistein, micromole genistein for 48 hours could reduce the expression of nuclear factor kappa B, TNF-alpha, IL-1 beta, and genistein prevent production nitric oxide and prostaglandin and inhibit the expression of COX-2 enzyme, also reduce pro-inflammatory cytokine IL-1 and TNF-alpha. And genistein treatment produce statistically significant regression of endometriosis implant in rat, most probably through the action of genistein as antagonist estrogen in endometriotic implant. And genistein inhibit endometrial cell proliferation and estrogen receptor expression in apoptosis in endometric cell culture. So, as conclusion of our study, in mice model of endometriosis, genistein effective to suppress the expression of ERB, NF-kappa B, TNF-alpha, L1 beta, EL6, and EL8. The dose range from 50 to 500 kilogram body weight had similar effect in all variable. Genistein may be to be hope for future therapy in endometriosis. Thank you.